executive management team, and they are seated at the head table. To my far left is Acting Director of Surveillance, Disease Prevention and Control, Dr. Horace Cox. In the middle, we have our Ad Interim Executive Director of Carpha, Dr. Lisa Indar. And to the right of Dr. Indar is the Director of Corporate Services, Dr. Mark Sami. And I'm Colin Curtin, and I'm the Head of Communications at the Caribbean Public Health Agency. I'm also Chair for this morning's proceedings. Also joining us, a warm welcome to senior officers of the Ministries of Health of our member states, representatives of our international donor partners, members of the Carpha management team, journalists here in person and also joining us online. Ladies and gentlemen, a welcome to you all. We believe that it is very important for us as the sole public health agency for the Caribbean region, the agency that leads the public health response for our 26 member states, to provide you with updates on our emergency response to most recent events that have impacted the Caribbean. And I speak specifically about Hurricane Beryl and the mass gathering out of this World Men's T20 World Cup. Over the last few years, more specifically during the COVID-19 pandemic, many of you came to learn of Carpha and the critical role that we played in supporting Caribbean governments in managing the spread of the COVID-19 virus. This morning, you will receive further insights, on the work that we do to the benefit of the people of this region. I am pleased to invite Dr. Lisa Indar, the Ad Interim Executive Director of Carpha, to provide an overview of Carpha's leadership role in public health emergency response and surveillance. I invite Dr. Indar to the podium.
Member states who are joining us online, our IDPs, other stakeholders, Carpha staff, and members of the media, a pleasant good morning to everyone. The Caribbean, due to its geographic location and climate change, is unfortunately susceptible to disasters like hurricanes. The National Hurricane Center has predicted an above normal hurricane season in the region. Meteorologists estimate 17 to 25 tropical storms, of which 4 to 7 have been forecasted to develop into major hurricanes. So from a public health perspective, disaster emergencies can cause negative public health implications, and there are some aspects that cannot be left behind but must be dealt with immediately. This includes surveillance and early containment of conditions that might arise related to the situation, such as food and waterborne, vector-borne, or respiratory diseases in overcrowded shelter environments, including water sanitation and hygienic problems that could arise. Hurricane Beryl made landfall in the Caribbean as a Category 4 hurricane on July 1, causing significant destruction and impacting on lives and livelihoods. Beryl affected at least 10 of our Carpha member states, including Dominica, Jamaica, Barbados, St. Vincent and the Grenadines, Grenada, Tobago, and the Cayman Islands, and Jamaica, resulting in extensive damage to infrastructure, including healthcare facilities, fatalities, injuries, and floods, leaving many without shelter, food, water, and electricity. Reports indicate that the Tri-Island state of Grenada, Carriacou, and Petit Martinique, and the Grenadine Islands of Bequia, Union Island, Canoan, and Meru in St. Vincent were the most severely impacted. To date, a state of emergency remains in effect in the islands of Carriacou and Petit Martinique after the hurricane. Beryl destroyed more than 90% of the islands. Additionally, there have been mass displacement of individuals, major damage to the property and essential infrastructure, and multiple casualties. Prelim assessments of the island of Petit Martinique, for example, suggest that 100% of buildings and homes have been damaged due to intense winds. On the island of Carriacou, many hurricane-related deaths have been confirmed by authorities who cited that there were significant infrastructural damages, up to 90%. The islands of Canoa, Meru, and Union Islands suffer 90 to 98% damage. Communication was disrupted. In St. Vincent and the Grenadines, it has been estimated over 1,000 persons were displaced. Overall, Beryl has affected 1.2 million people across our impacted countries, with additional rainfall being forecasted from tropical waves expected to hinder the relief efforts and exacerbate conditions. The Caribbean Disaster Emergency Management Agency, SEDEMA, as the regional agency responsible for response after natural disasters, has been leading the multi-sectoral and multi-agency response through the regional response mechanism, with its national, regional, and international partners such as Carpha, PAHO, the Regional Security System, UNICEF, and others. SEDEMA has convened several meetings in the Caribbean, meetings of the Caribbean Development Partner Group, and has coordinated response and relief efforts among stakeholders to the impacted islands. But response post-Beryl necessitated a rapid, multidisciplinary response, of which public health surveillance and response is vital. The post-disaster consequences of heavy rains, floods, together with large numbers of displaced people in crowded shelters, increases the likelihood of infectious disease spread, such as food, waterborne, vector-borne, STIs, and other issues, as well as placing significant strain on the health system. So in this regard, Carpha, given its mandate for public health response to emergency, is supporting the regional response to Beryl as part of the coordinating mechanism, and as well doing it in collaboration with member states and international organizations. Carpha began its regional response to hurricane impacted islands as early as July 1, 2024. Its multi-sectoral package of response include letters of support, rapid needs assessment, shelter surveillance tools, an emergency response package that includes surveillance and lab and communications and food safety, and a suite of technical guidelines, promotional materials, and deployment, as well as laboratory supplies for testing. Carpha deployed Dr. Gerald Branford, our technical officer in emergency and response, as part of the SEDEMA-led rapid needs assessment team. Myself, as the interim executive director, joined Ms. Elizabeth Riley, the executive director of SEDEMA, from 10 to 12 of July to stand in solidarity with Grenada, as well as to provide guidance to response to the emergency operations centers, the Ministry of Health, and the Prime Minister and their teams. Member states are now in recovery mode. Next week, Carpha will deploy persons to St. Vincent and Grenada to support recovery efforts. Additionally, a package of essential public health supplies such as sanitizers, repellents, oil rehydration salts, water purification tablets have been rapidly purchased through the Pandemic Fund grant and will be sent with the regional security system to St. Vincent and Grenada. I will also present the impact of the public health impact of Beryl at the heads of government meeting in Grenada. Dr. Cox and Dr. Sami will bring more details to our response. As I close, Carpha remains committed to working with the Ministries of Health, SEDEMA, our regional and international partners to ensure a well-coordinated, effective health and disaster response to hurricanes and other natural disasters to safeguard the health and well-being of the people of the region. Thank you.
Thank you, Dr. Indar. At this time, I would like to invite our Acting Director of Surveillance, Disease Prevention and Control, who is also head of our Vector-Borne Disease Unit, Dr. Horace Cox, to address you on Carpha's technical response to natural disasters, particularly as it relates to Hurricane Beryl, which, as we just heard, would have devastated several of our member states. I invite Dr. Cox to the podium, please.
Thank you so much, Madam Chair. All protocols observed. Greetings to those in room and also those who are online. If you just bear with me 1 second until the presentation is on screen. Okay, thank you so much. So I know many of you are familiar with the Carpha context and what we offer to the Caribbean region. But this presentation will kind of like put it into perspective regarding how we continue to support our member states in the midst of the aftermath of Hurricane Beryl, as well as we look on the public health horizon and see the different public health threats that do exist. Firstly, I'll just provide an overview as to what Carpha is. I know we have several stakeholders who are very familiar with our mandate, but also catering for those who are new and joining us for the first time and might be interested as to how we support member states in the execution of their duties in addressing any public health threats. After that, I'll transition through a few slides that will speak to food safety, water and environmental health safety, surveillance systems, vector control, and laboratory services. So I really trust that we've been able to preempt some of the questions with which you would have come, and if not, we'd be happy to address those at the very end. But having said that, perhaps just to put it into context a bit, and again, bear with us for those who are very familiar with the mandate, but Carpha is really an amalgamation of 5 regional institutions. And this amalgamation really happened in 2011, but was operationalized in 2013. Having said that, we serve 26 member states. You see them listed there, and they include associate member states. And as part of our vision, we see a Caribbean of healthy people, healthy spaces, and of course, a healthy Caribbean. And the goal is to ensure that we have a Caribbean in which people are resilient, living longer and healthier lives in a more supportive environment. But this next slide should be no new news to you, if I may put it that way, because we're aware that we have several public health challenges. Perhaps the one that resonates with us is the recent transition from the COVID-19 pandemic in the sense of it being a public health emergency of international concern. But also we've had others within the past 5 years that would have piqued our interest in terms of how we respond and continue to support member states. I share, for example, Mpox, the recurring issue of AMR and antimicrobial resistance, vector-borne diseases. We know of the issues with dengue coming from 2023 into 2024. We've heard of the vaccine preventable diseases like measles. And of course, we see those other issues, for example, noroviral infections that can cause outbreaks of gastroenteritis, etc. And again, this is just a microcosm of all the issues on the public health horizon that continue to affect our region and to which we have to respond on a daily basis. So transition into food safety, basically in the Caribbean region, as you know, we're a tourist destination and about 14–15% of our GDP comes from tourism. And in that regard, we have to cater to the needs of not only our population, but those who visit in the region. So having said that, any disruption in food storage conditions or any improper handling practices and contamination of food supplies can really be an issue, especially post-disaster, even in the absence of a disaster. As a result of that, Carpha has not waited for this to happen in order to respond, but in preempting it, would have already started to build capacity among member states over the years in terms of food safety practices and ongoing foodborne disease surveillance efforts. Of course, in the midst of the of what's happened with Hurricane Beryl, we do have the opportunity to fortify that stance and to continue to roll out interventions as per the plans that we would have developed in collaboration with member states. So at this time, what we look to do is to continue to engage member states, continue to see how we can support their capacity building, and to help them to strengthen any gaps that would exist in the current system. Next, I'd just like to take you through another important aspect, taking into consideration Hurricane Beryl and how member states have been affected. As we heard earlier, we've had about 10 member states that would have been impacted by Beryl. And of course, as we're all aware, the hurricane season goes until November. So this is just the start. And therefore, it's a real test of our resilience as to how quickly we can bounce back and to be able to address any issues that they might be at hand. So setting aside food safety, we also have the issues of water safety and environmental health safety. With regards to water safety, Carpha has been supporting member states with water quality monitoring as part of routine environmental surveillance. And in emergency situations, we particularly emphasize the need to access clean and safe water as a priority. And of course, that's tied to sanitation and hygiene. Just to put it into context, as I mentioned before, we do serve 26 member states, but we've been able to support at minimum 8 of them in terms of having very responsive systems in this regard that they can address water safety issues that may arise. And of course, these things come to bear and the potential impact can be seen now that member states are responding to Hurricane Beryl. It's not to say that we don't have gaps that still continue to be, but at least we have an infrastructure that would have been built prior, and we continue to assess those gaps, how they evolve before the emerging public health threats that are tied to natural disasters as well, and then look to see how we can fine-tune our response. Environmental health safety, we're very focused on ascertaining what issues they're there and also doing risk mapping. And just to share with you that we've had comprehensive assessments of environmental health systems, and we continue to do this in conversation with member states, especially those that would have been impacted. We're particularly emphasizing the point of ensuring effective waste management. Solid waste management in the whole context of a disaster becomes critically important, tied to the potential emergence, reemergence of diseases. We know we have a lot of vector-borne diseases, etc. And also to ensure that safety barriers are not compromised. Again, it's a real test of the resilience of the infrastructure that's in place, and at a time of natural disasters, etc., this can really be put on the strain. But what is everything without surveillance? What's everything without the ability to be able to detect and also to respond in a very effective manner? So from that perspective, just to reiterate, and in keeping with the earlier slides, surveillance is at the core of Carpha's mandate. Essentially, what we focus on is integrated surveillance across the Caribbean region and look to see how we can very well support member states in being able to make their surveillance systems more responsive to the threats that are on the horizon. Just to highlight that in this particular context, as much as we do have, or we have committed to integrated surveillance, there is particular focus on event-based surveillance. We'd really like to know what is happening, when it's happening, and we really monitor how those reports are being channeled. We monitor the airwaves and everything else, and also any rumors that might be there and any informal means of channeling those reports. And of course, we use this to complement the existing and fairly robust infrastructure of syndromic surveillance and the other routine surveillance, for example, in disease-specific surveillance, etc. So, and you may ask the question, but why are they speaking so much about event-based surveillance and, of course, looking at what's happening at the level of shelters? It's because, as we've established, Hurricane Beryl would have hit some perhaps harder than others. And as a result, you have persons who have had to be accommodated on the shelters. And we've understood that based on the assessment that these shelters will be, while they're supposed to be temporary, the temporary may be as permanent as 6 months or longer. And that is a frightening situation. And for the simple reason that the sanitary conditions, hygienic conditions as we know them and as we recommend, and that would be routine in normal circumstances, become compromised because, or could become compromised, I should say, if we don't have the right mechanisms in place. So we really want to be picking up or be responsive enough that we can detect as soon as something happens and be able to respond to it in a very effective way that we can break transmission. Just imagine everybody in a crowded setting and then you have an outbreak. It's really recipe for chaos. Added to one trying to respond to any natural disaster that might be there. So we continue to support member states. They've already taken the initiative in terms of implementing shelter surveillance programs. We've been revising the tools that we have in terms of the forms that feed data collection, and we have been making these tools available to them and providing other things in support. So the emphasis is on real time. As persons know, at times when we're in need of something, we say, well, we need it real time. It needs to happen right now. And that's the approach that we need to take when we confront these public health threats on a daily basis, because the repercussions can be devastating if we do not have real-time detection, real-time surveillance, and have a response which is commensurate with the threats that we do face. But even though surveillance is a key part of the mandate, it's important to highlight that Carpha as hosting the Carpha Medical Microbiology Laboratory, which is the regional lab within the Caribbean, would offer a number of laboratory services. And of course, these services come into perspective quite quickly, especially in the context of natural disasters. And even outside of natural disasters, we do have the issues of having to respond to public health threats on a routine basis. So we can understand why we need laboratory services. We need to be able to say, we need to be able to distinguish that this is what we think it is, and not just be arming a response based on suspicion. Having said that, we have been preparing from the perspective of we're aware of hurricane season when it begins, when it ends. We're aware that it's going to be a hyperactive hurricane season. We are aware also of the strengths and weaknesses across the region in terms of health systems. So we have been considering how best could we, being forewarned, forearm ourselves in terms of a response and support member states. So just to note that Carpha has been working with member states to increase testing capacity and efficiency. And in cases where that capacity might be challenged, we do cater for surge support. So for example, countries that might have been severely affected by Hurricane Beryl, and perhaps they have to, or perhaps you have an outbreak situation and there's need to really quadruple that response effort at the lab level. We do understand that at times there is need for immediate support coming from elsewhere. So Carpha is positioned to provide that support and to be able to help member states to address the issue which is at hand. Of course, that happens in conversation with member states and with support from IDPs. Having said that, it's important to say that, and tied back to Cricket World Cup, we've understood in very clear terms that apart from being a reference laboratory, at times we need to deploy and be set up to be able to deploy at short notice or at a moment's notice. And in such a case, we would have piloted an effort in during Cricket World Cup where we would have deployed mobile lab teams using different pieces of equipment, as you can see there, the staff in different member states supporting them. So this to say that as part of the whole surge capacity effort, if we do assess that there's need to respond in a more comprehensive way and provide on the ground support, that we are so positioned to do so. And of course, member states would have been accessing the lab services that we do offer that would extend from just molecular serological testing to also doing gene sequencing and the other things. And currently, we're even understanding the whole context of the need for sample collection and safe shipment, etc. The team is currently implementing IATA training across member states. I think that by next week, we would have trained about 4 member states in just 1 month. So I think that we are using the opportunities to really address the core of the problem as far as we've assessing conversation member states. And just coming to the last bit of the presentation, I know many persons have been looking at the media across the region, also looking at what obtains globally, and they would have seen that we have spikes of cases of dengue, and it is to say that This was sort of forewarned at the beginning of the year. We understood due to the climatic changes that 2024, we should really brace in 2024 because it's likely that cases in 2024 will significantly surpass cases in 2023. Setting that aside, what we've seen from the data reported so far globally is that you have about a 200-fold increase on suspected dengue cases in 2024 as of the first 6 months compared to similar period in 2023. So that kind of puts it into context as to what's happening. Now, when we accept that forecast that was made perhaps the end of last year, started this year, and we add that to what's happening with Hurricane Beryl, we could understand how impactful it could be if we don't really mobilize an effective response in time. So I just wanted to flag that some of what we're seeing happening at the global level as well as the regional level is tied to the climatic change that we've been noting and some of the oscillations. And also, as we're very familiar as a Caribbean people, we do a lot of inter-island travel. We're endemic for the Aedes population, a very competent vector in terms of arboviral disease transmission. And also, importantly, we have undefined pockets of susceptible population, which means that we don't know who would have had a disease before, and perhaps after a certain period of time, the immunity to the disease would have waned, and as a result, you become susceptible, or whether you would not have had immunity in first instance. This is problematic. And just to continue to put it into context, we know that every 5-7 years, this is documented, we tend to see a big spike in cases, and we try to use that information to inform how we mobilize our efforts and the timing of our efforts. So this is to say that we've been working closely with member states to sensitize on this process and also ensure that as far as we understand the gaps at national level, we can provide that support. Understanding too that this occurrence tends to happen ever so often. And also we are expanding in terms of new approaches. So we're leveraging access across the Caribbean region. This is not just for vector-borne diseases, but also for laboratory services. We do have the Caribbean Public Health Laboratory Network, CARIFLIN. For vector-borne diseases, we do have CARIVECNet, which is a Caribbean vector-borne disease network, and we leverage the expertise that is across the Caribbean region that might be deficient in a particular member state or the other to ensure that we can provide that support over a continued basis, and we'd be able as a team, as a collective, to respond to whatever may arise. So I know that it's a topic that takes a lot of interest, but just saying that there are many reasons as to why we observe what we observe. And I think the emphasis is on ensuring that we can intensify the efforts that are tied to what we propose, which is integrated vector management, and of course ensure that at the community level, we're managing the breeding sites. And of course, here's where surveillance comes in. So we should be at the different programs across the region, and we continue to support member states with this, monitoring the mosquito populations to ensure that we understand the risk of transmission of a disease and also of an outbreak being established, and to be able to get in those very early signals to be able to respond in a manner which is warranted. Having said that, and coming to the end of the presentation, and speaking a bit more about vector-borne diseases, we know that in 2016, we had the issue with Zika, 2015 with chikungunya. Of course, it varies across the region as to when what appeared. But having said that, we do have Aedes aegypti, Aedes albopictus, and we understand that they bite at different times, and also they're very competent vectors in terms of transmitting arboviral diseases. But at the same time, as I mentioned earlier, we're not exactly clear as to who is susceptible because they may not have immunity to a particular type of disease or a serotype of the disease. So we need to ask ourselves the question, we're addressing dengue now, but what could happen if we were to have another outbreak in terms of Zika, which is something that we have been discussing for months now. Not to say that this is an issue currently, but just to indicate how we forecast what the public health threats could be. And that's how we use that assessment to inform how we plan and implement our activities. Also, persons would remember chikungunya quite clearly for the joint pains that were caused and even after they would have recovered, they still had these joint pains. So really and truly, we ask ourselves the question of what could be next, and it's a scary question to be put in the position to answer. But as a public health agency, we prefer to be addressing the tough questions so that we'd be able to respond in an effective manner. So I spoke about the threats to epidemics, and then there's some re-emerging diseases that we've been noting. Just to mention also that we've had, on the horizon in the region of the Americas, not necessarily the Caribbean, but we've seen a lot of cases of chikungunya in the region of the Americas and also of Oropouche. These are other arboviral diseases. And so we need to ensure that, we really think of vector control in an integrated manner. So I'll just leave this as the last slide in terms of some of the things that we're doing across the Caribbean region in terms of ensuring that the vector control responses are fine-tuned to some extent to be able to address the challenges that we have. And perhaps to put it into context, one of the things we're very cognizant of is that we need to monitor the resistance levels to certain insecticides. I know generally people are very receptive to seeing adulticidin, or what we call fogging. And the reason is that it's something that's tangible. They see that something is being done, but it's not always indicated for every situation when it comes to vector control, or more particularly mosquito control. So there's a time when it's recommended to maximize effect, and there's a time when we recommend complementary interventions such as larval source management, etc. So I know persons may be uneasy, and at times in the community they say, well, I don't see adulticidin or fogging being done, and they think that nothing is being done. But I beg to differ. As I mentioned, the approach needs to be tailored to the context, and we continue to work with member states and support them in that regard. I think I will leave it here. Thank you so much for your attention.
Thank you so much, Dr. Cox. That was a very comprehensive presentation, and I'm sure that we all benefited quite a lot from the delivery of the presentation. It is my pleasure to now invite the Director of Corporate Services, Dr. Mark Sami, and Dr. Sami will provide updates on risk communication and the provision of essential supplies, also critical components of our emergency response. I invite Dr. Sami.
Good morning, all. Thank you, Ms. Curtin. So my task is to give you a brief update on what Carpha is doing in the areas of risk communication and procurement of supplies. All right, so just a note, this is nothing new to the agency. We have been doing this since the inception. Just to name some recent support that we give to member states, we would have coordinated the 3 million doses of Pfizer vaccines that came into the region in 2021. And we also, through CDEMA, assisted with the coordination of the donation from the World Health Organization through the Jack Ma Foundation. And that included millions of pieces of PPEs distributed to our member states. And we also provided member states with lab equipment and supplies during the pandemic and of recent. In the area of risk communication, we also provided toolkits and messages to promote vaccine uptake. And we had various workshops to train member states of the RHCN, which is our Regional Health Communicators Network, which includes the focal points of all the 26 member states on infodemic management. So to the current support, firstly, what is risk communication? It is a critical tool in emergency preparedness and response. It gives people the tools to make informed decisions and to mitigate the effects of a threat or a hazard. So Carpha provides guidance on effective risk communication, which allows public health officials to minimize damage, prevent widespread illness and disease, and even save lives. So what have we done in the area of risk communication? Firstly, to assist member states in their response to the hurricane season. So we've mentioned Beryl a few times. We provided the communication focal points, the RHCN that I just mentioned, in our member states with messages, communication, and health promotion toolkits focused on health risks and dangers associated with heavy rains and storms. And we also, that included messages on food and water safety, hygiene, infectious and vector-borne diseases, waste disposal, etc. We would have distributed through our social media and other channels many guidelines on overall safety, water safety, food safety, hygiene. You would see a lot of these on our websites as well as our social media. We also distributed various guidances when it comes to mosquito awareness, various toolkits to member states. And we also provided guidance, health and safety posters as well to all of our member states dealing with many of our areas of work. You would see there hand hygiene again, foodborne diseases, and all measures of support to member states, which are very, very helpful and needed at this time. Good. So we also did some work on mass gathering events. We developed a risk communication and community engagement plan, an RCCE plan, which was developed and distributed to the RHCN that I mentioned. And the plan aims to identify the major health and information hazards during and after the T20 Cricket World Cup. So it's not just for the Cricket World Cup, but it can be used for other mass gathering events. It also plans to assess the level of risk and to identify and implement communication mitigation measures for those hazards. Having developed that plan, there was a workshop in May of this year in partnership with PAHO, which facilitated training on the RCCE plan to build risk communication capacity among our communication focal points in our member states. And this meeting was highly represented. 24 of our 26 member states participated in this 3-day workshop. This is a testimonial from one of our many member states. And the person says, I must say a big thank you to Carpha and PAHO. The information from the workshop in May 2024 helped tremendously. Health Promotion was able to create and facilitate a mass gathering committee ahead of their carnival celebrations. We brought stakeholders together to be productive and not reactive as we prepared for the large amount of people coming for the celebration. Health Promotion was able to see the need and take action, which allowed for several measures to be in place. Health messages, health stations, disaster preparedness, etc. Thanks to all. In terms of supplies, Dr. Cox would have mentioned the digitalized systems that we did, the tablets that we supply to member states to assist with their real-time shelter surveillance. So we send this to 6 member states, and this equipped them with instant alerts and reports, and also allowed for rapid alert and response to reduce the workload of data entry and analytics. This is where we supplied it to the 6 countries that hosted the Cricket World Cup. We have St. Vincent and the Grenadines, Trinidad and Tobago, Guyana, St. Lucia, Barbados, as well as Antigua and Barbuda. So now that we had 2 countries that were heavily impacted by Hurricane Beryl, we're going to be shipping this weekend to 2 countries infectious disease rapid test kits to aid the infectious disease surveillance. We're targeting respiratory viruses such as influenza, COVID-19, RSV, as well as gastrointestinal viruses and bacteria such as Salmonella. We'll also be sending kits for testing on sexually transmitted infections such as HIV and chlamydia. We'll also be sending antiseptics and sanitizing agents, water purifying agents, water quality testing kits, as well as hydration and rehydration salts. In terms of vector-borne, we have been supporting member states in the area of vector-borne for the last couple of years, as Dr. Cox mentioned, in vector protection and control equipment. We give them lab supplies, repellent nets, fogging machines. We have a picture there of the fogging machines that we would have sent to member states to assist them with their vector control measures. And those are some of the PPEs and other protective equipment that we'll be sending to member states. And we also have the RSS plane there on screen that has been helping us tremendously in getting the supplies all over the Caribbean when we don't have a lot of options available to us. So we stand ready to provide additional support during this expected busy hurricane season. And we'd like to signal out our many partners that give us assistance in supporting our member states, the ACP EU, the CDC, CARICOM, IDB, the RSS, CDMA, PAHO, WHO, the Pandemic Fund, the World Bank, and of course, our 26 member states who support us as well. So thank you.
Thank you, Dr. Sami. That wasn't too bad, right? As I mentioned earlier, the COVID-19 pandemic brought Carpha and public health as a whole to the forefront. But public health to many can still be invisible. So you may have picked up from the presentations that Carpha made a significant behind-the-scenes contribution to the success of the Men's T20 Cricket World Cup. How so? I invite Dr. Lisa Indar back to the podium and she will explain.
So I'm going to talk about changing the topic from Hurricane Beryl, as Ms. Clayton said, to how we responded just recently to the Men's T20 World Cup. Hurricane Beryl came off just the day after, so we haven't been able to share our experience, but we wanted to share our experience, the way we operated. So just a bit of a background in terms of the public health aspects. The ICC T20 is one of the largest ICC events to date. There were 20 teams, 20 countries, 55 matches occurring over 28 days. And what did this mean from a public health point? It meant an increased risk of infectious diseases and spread through that movement of many different types of people and being able to stay in close quarters next to each other. So we see here all the different types of risks of diseases, crowding and hygiene and different types of infectious diseases. So what has Carpha done? So Carpha, as a regional public health agency, have had a multi-pronged approach. As the chair of the Health and Safety Subcommittee, we coordinated the health response. What did that mean? We had monthly meetings with our CARICOM and other agencies and PAHO, including the ICC and the Cricket West Indies, and how we better coordinate the health response. We had monthly meeting with our chief medical officers and Cricket West Indies, and to ensure that we were well prepared for any type of public health events. We conducted a series of risk assessments, regional, national, public health risk assessments, so that countries had an idea what were the higher risks and where to focus their efforts on. We worked with our member states to do a field hospital training to support medical response, as well as a simulation exercise, simulating what should you do if you had a possible risk. We developed a novel regional mass gathering surveillance system Dr. Sami mentioned, and I will speak about it in a bit, but this allowed us to be able to capture events in real time for real response. This was supported by laboratory support, testing, taking a special equipment called a MolBio to countries so that we would be able to test for samples within 2 hours rather than 5 hours and 2 days and so on. We then supported through capacity building, food safety, vector-borne prevention and control of infectious disease, not just for the local population, but for the hospitality sector. And we had a series of risk communication, and we also worked through our partners, health and tourism, to ensure that we were protecting both sets of population. All of this was done through a collaborative approach, not just by Carpha, but with PAHO, our security cluster, ICC, Cricket West Indies, tourism, and the public health agencies. At the games, this was all done, previous slide was done before the games. During the games, we enacted our teams. We were on site with countries at the stadiums to ensure that we were supporting them to do proper surveillance and response. So what it really means in layman's term, if you had something, you nip it in the bud and you avoid spread to the stadiums and to the visitor population and the local population. Daily, we had, if there was any form of specimens for testing, we had those rapid test kits to do testing within 2 hours. We had search teams, we had risk communications, and we supported that through data entry tablets, supplies, equipment, technical support. So this is just an example how we work with the countries. You saw the 6 host countries: St. Vincent, St. Lucia, Antigua, Trinidad, Barbados, and Guyana. And just for some photos and how we worked in terms of the training and liaising at the highest level with the ministers of health, chief medical officers, and the different sectors. In terms of risk communication, this was important. You needed to know what risk you were dealing with to be able to be better prepared. So we had 3 sets of risk communication: a travel health risk assessment, national all hazard risk assessment, what was a national preparedness spectrum in terms of mitigating specific hazards, and for the host country to identify and to see how they can mitigate against these potential threats. And then we merged everything together for a regional all hazard approach. So it came down to this in terms of what was the region at most highest risk for during mass gatherings of lots of people from different countries. So of course, illnesses like respiratory illness, you would have the highest risk: COVID, influenza, RSV, and other infections, because of that increased circulation and persons being in close contact. And we recommended interventions like flu vaccine, surveillance, vaccination. Measles, cricket started just before the World Cup started. We had a confirmed imported case in the Caribbean. So we wanted to ensure that we were closing all the gaps in terms of promoting vaccination coverage. Of moderate risk was pathogens, enteric pathogens, your food, your waterborne, your bacterial, and so on. We counteracted that by making sure we were training. So we did vector-borne training, foodborne training, waterborne training, and so on. This is the training with the Barbados Defense Force. Some of the communications workshop that Dr. Sami just spoke about. And some of the key inputs is developing that novel mass gathering surveillance system. Nowhere in the world has such a system, with early entry analysis, as well as inbuilt threshold for automatic alerts. We provided tablets, we provided laboratory supplies, reports, daily national and regional reports, amounting to hundreds of reports within 30 days, as well as a lot of materials. Wouldn't go through this, but to show that we really amassed, a large amount of persons trained and capacity built in risk communication, surveillance, mass gathering, simulations, food safety, rapid response, laboratory training. And this was the framework we use in terms of getting information. And getting information means we had to get information from our countries, our regional partners, our international partners, analyze that daily and real time so that we can respond. Just to go quickly, the system allowed us to do this was this mass gathering surveillance system, where you had different platforms, different levels of confidentiality, but what it allowed was getting information in a rapid manner and analyzing electronic data entry, alert mechanisms, instant reports, and an analytical dashboard. So the benefits, we had a platform. This took some time doing. We had to create national coordinated systems with WhatsApp and email groups and so on, but this is already now developed. Capacity is there, collaboration is there, the infrastructure. Why am I saying all of this? We have the CPL, we have other type of mass gatherings that are coming up, all the carnivals and so on for the region. So Carpha is saying that we are standing ready and we are working with countries to prevent disease spreads during these types of events. Just for one thing, people ask, well, why all of that is important? While the data here shows this, it was important to speak about alerts. There was one particular situation where persons were sick in the games. And this is a game that is occurring for 2 hours. And the persons were moved during the games. They were isolated. So this is what you call a real-time response. Normal surveillance wouldn't have picked that up. But while the game was occurring, this was occurring. So we were protecting the region. I would not go through the dashboards to just show about how we got daily lab reports, This is the equipment we use to test within 2 hours, and we test this wide range of pathogens here, influenza and malaria and dengue and so on. Something is not working well. We're missing some of the slides. Okay, so we had press releases, lots of social media campaign. I want to go back to the fact that countries were provided with daily reports in a short space of time. The system worked with 34 regional health security reports from all our partners that you're seeing there, this type of information, as well as 204 country reports and 7 aggregate reports. Mark showed this slide. I don't think we can see some of the photos. Okay. I think this is a good place to stop, but just to reiterate that Carpha implemented the system so that we are better able to equip member states to deal with mass gathering events and to be able to rapidly identify any negative public health event, nip it in the bud so that you don't have negative effects occurring.
Thank you so much, Dr. Indar. So while many of you would have thought, you're still busy after COVID, you're not really doing anything right now. You see that we are doing quite a lot. We continue to do quite a lot of work for our member states. And now I guarantee that no one will ask me, at least anybody who is online or in person here will ask me, what is Carpha doing? So you see the extent of the work that Carpha does. We are now at the question and answer segment. If you are on Zoom or in person, I invite you to use the raise hand icon. I will then open your microphone, allowing you to ask your question. Please give us your name, the name of your media house that you represent, and also the country that you represent before you ask your question. You also have the option of placing your question in the Q&A, or if you are on YouTube and you would like to ask a question as well, you may pose your question into the chat. Please note that we are a regional organization, which means that we will respond to questions that are regional in nature only. Any questions that are country or member state specific, we are going to defer your question and ask you to raise that with your local Ministry of Health. So, okay, we have a question in-house from CNC. May we have a microphone so that I would like to have your name, and I believe you are with CNC.
Thank you. Good morning, Jesse Ramdew, CNC3 News. Thank you very much for the presentation. Perhaps to Dr. Cox may be suited best. You would have indicated, doctor, that there was a forewarning of sorts in terms of the cases of dengue, and we're seeing a 200-fold increase from 2023 to 2024 in persons infected. Has there been any sort of metrics, any sort of analysis in terms of overall deaths, or perhaps any work going into analyzing how many deaths could be resulting from these cases?
Hello? Okay. Sorry, I was looking for the light. Thank you so much for the question. So just one minor correction there. So it's a 200-fold increase in suspected cases, not confirmed. Of course, we've seen spikes in confirmed cases as well as hospitalization. So the way I put it is that once you have more confirmed cases, you'll find all the other things happening as well. You'll find more persons progressing to stages of complication, meaning that you have more cases of hospitalizations as well as deaths, unfortunately. Perhaps what I could confirm also is that based on the data we've been looking at, not only regionally, sub-regionally, but also internationally, we've seen a concomitant rise also in deaths. And there's a reason for that, as I mentioned. More persons become infected, the greater the likelihood of them complicating to either be hospitalized or some, unfortunately, may progress to the stage of dying, unfortunately. But having said that, I just wanted to use the opportunity to reinforce one point, which is that on that level, we strongly encourage persons not to take things for granted. It's often dismisses the disease as that is self-limiting, meaning that for dengue, you can just take symptomatic treatment, whether it's an analgesic, you can rest, you can be hydrated, but it's a misconception. So especially at a time like this, I strongly recommend that persons, if they suspect, based on the sensitization that is ongoing, that they may have dengue, that they go to the nearest health facility and access that level of care, because the time that lapses can make persons complicate, right? And that the danger signs are missed, etc. So I think that's the main point that I'd like to leave in that regard.
Sure, go ahead.
Hi, Renessa Cutting, TV6 News. Could you tell us what we are seeing as it relates to chikungunya and Zika, please, in terms of cases and locality?
Correct. Correct. So to answer the question also, so related to Zika, as we mentioned in 2016, the Zika epidemic was very explosive. And there's a reason for that, meaning that it ran through the population very quickly. The reason is that the population was at the time what we term immunologically naive, meaning that the immune system was never exposed to this before. It was a novel infection, and so it moved through almost everyone that was exposed to it, to put it crudely. Since then, and at that time, it was thought that the immunity or the protection from being exposed and infected with Zika would have lasted the lifetime of the individual. But evidence has shown in other regions globally that the immunity wanes. So whereas it thought that persons might last, for example, for the remainder of the life course, you find that after 3 years, 5 years, that it's waning. And because of that, people are becoming susceptible. And that explains what we've been seeing at the regional level. When I say regional, sorry, I speak of regional Americas based on the data that's available and also internationally. And this is documented, where you're seeing a resurgence in Zika cases and to some extent also chikungunya. And it's for the reason that I explained, that immunity is waning. And as it wanes, you have new pockets of susceptible population, which I was explaining earlier. So it's important that we understand how the immunity level is in the population. And from the perspective, Carpha would have committed to doing was a vulnerability assessment to basically assess within the population the level of immunity and how that is behaving over the past number of years. The difficulty I should highlight once more with Zika, and this is what makes it a difficult public health issue, is that 80% of the cases are either mildly symptomatic or asymptomatic, meaning that if you're looking for a particular thing to say, well, I may have it, often it is missed. And because of it, it's difficult to stop transmission. So as we know it, it's not an immediate issue, but we do assess that it could be a real threat, understanding that the immunity is waning. And on the point of chikungunya, likewise, in other regions, we've been noting that you've had spikes of cases of chikungunya. And for the reason I say that, we should really be looking at integrated approaches to address the vector. Because in the Caribbean, it's basically the same mosquito or mosquitoes that would be spreading these diseases. So that's why we are proponents of integrated approaches to addressing the vector. So to summarize, we're seeing resurgence of both, more particularly outside of the Caribbean region. And we just reemphasize the point that as we address one issue, for example, we're addressing dengue now, which seems to be the immediate threat, that we also remember that as we address that, we're addressing all the others, chikungunya, Zika, at least from a vector control perspective.
But have there been any recorded cases in the Caribbean of chikungunya at this time recently?
Yes, unfortunately, I didn't bring the data, but if memory serves me well, I believe we may have had at least an imported case recently, but as far as I know, we've not had this as a main issue. But we'd be happy to check and give you perhaps a more detailed update.
Just one more.
Just Jesse, just allow me to have a question from online and then we'll come back to you. Thank you. Dion? We're not hearing you. Okay, while we,
So we have a question online from Tamika Johnson Brown. Your hand is raised. Please go ahead.
okay, I think we'll come back to Tamika and I will allow Jesse to go ahead with his question.
All right. Thank you kindly. Doc, perhaps some guidance on this, right? Given that we're seeing in terms of numbers for the calendar year so far, the increase in suspected cases, and you know, the climbing death toll or the potential of the death toll rising as a result of dengue, can you perhaps advise on what constitutes territories in terms of declaring dengue a public health emergency?
So that's a good question. I'd say that, of course, as you mentioned, it territory is declaring. So from a regional perspective, we cannot impose on the declaration. And of course, what we do know is that that declaration is informed by protocols and guidelines that are established at the national level. And we're well aware that those guidelines exist. And we've been following closely across the region what's been happening. And as far as I can say, those guidelines are being adhered to. So I would say that there are established protocols as to declaring something as a public health emergency, as a risk. And as far as I've been following, those have been adhered to at this stage. And that's that's looking at nationally and how we support. At the regional level, we continue to assess what the data offers. And of course, we will update or we will share any updates as we have them regarding any change in regional status regarding these diseases.
Yeah, good day. I'm Sean Douglas, Trinidad Tobago Newsday. I was interested in what you said about a 200-fold increase, and I wanted to see if you had more specific figures for the suspected dengue cases. Could you say what the figures would have been for last year and for this year?
Yeah, I appreciate that. Just to clarify, because I don't want it to be misconstrued that we have it's 200-fold increase in suspected cases. We've also seen that trigger effect where you have increase in confirmed cases, in hospitalizations, in deaths, etc. But it's suspected cases, and this is at least broader than the Caribbean region, I should say, to put it crudely. Having said that, I don't currently have with me the disaggregation of what it may look like in terms of hospitalizations and deaths. I have not brought that data, but we can look to see and we can share that from a regional perspective as to what obtains, because we do have the data, just that I don't have it with me at this time.
I just wanted to absolutely pinpoint that we're talking about 200 times as many cases.
Correct.
For a 200%. No, I want to distinguish. 200% would mean 3 times as many cases as last year, whereas 200-fold means that for every case last year, you have 200 cases. So I actually want to get, which one is it, please?
It's 200-fold. So I think, sorry, but I struggle a bit to distinguish between what you said.
Right.
But just stating that
Is it a 200% increase in cases?
No,
or is it 200 times more cases? For every person who had it last year, we now have 200 persons have it, or for every person who has it last year, we now have 2 persons additionally.
I appreciate the question. So let me share the answer this way. It's 200 times the number of suspected cases that we had last year at more of a global level compared to what we're having this year, right?
But the Caribbean, that's globally. How are we doing in the Caribbean?
Well, in the Caribbean, we are currently looking at the data. We have seen increases and we understand the percentage increases. But I just use it to illustrate the trickle effect because as I mentioned, this is not something that is just specific to the Caribbean. It's something that is happening globally internationally, the region of the Americas and also the Caribbean level. We'd be happy to provide general Caribbean data in a follow-up. We'd be happy to provide that.
Right. And also in one of the presentations, I saw on the slides, I saw the word COVID mentioned. Could you give us an update as to what sort of COVID numbers we're seeing in the region, please?
Okay, so in terms of COVID, just to say that after the declaration was made, that's no longer public health emergency of concern. The whole COVID surveillance has been integrated into routine respiratory illness surveillance, which is what we call SARI-ARI. Recently, we were looking at the trends that have been happening. We have seen that you have a few variants, particularly subtypes of Omicron that have been causing the current cases that we're noting, and we've seen surges in some instances. Regarding whether it surpasses what we've seen in recent years, no. Because the data doesn't show it at this stage. And also, as we know, a lot of persons would have had the opportunity to be vaccinated, and a lot of persons are familiar with what's happened or would have been exposed to the disease before, and also familiar with the public health non-pharmaceutical measures to be taken. So to summarize, we have seen surges in specific instances, but those surges do not amount to there being surpassing the totals that we've seen over the past years.
Just one last.
May I allow the persons online to ask questions and we'll get back to you. Thanks so much for understanding. Dion, are they ready?
They're ready. So we have a question from Naomi Harris of the Guyana Chronicle. She asks, could you speak on the organization's response to Hurricane Beryl? Again, from the Guyana Chronicle, Ms. Naomi Harris. Could you speak on the organization's response to Hurricane Beryl? And Ms. Bridget Smith, thank you for the great presentations, updates, and continued support to the region. What were the composition of the response teams on the ground, for example, the ICC Games, and where were they drawn from? Local ministries of health, regional agencies, etc. Thank you. And this is Bridget Smith.
Can we allow the responses to those two, and then we'll go to the third one, Dion.
Just to highlight, Fallon, before we go, that Bridget Smith is from the Division of Health, Tobago House of Assembly.
Sure.
Yes.
Dr. Indar.
I would speak on the two
We're
questions.
not hearing you.
Right. In terms of the organizational response, yes. So Carpha, as a regional public health agency, is supporting the health response to post-Beryl. We do have SEDEMA, which is the Caribbean Disaster Agency, is coordinating the disaster response with Carpha as well as FAHO and other agencies. But from a health perspective, Carpha is supporting the health response in the areas of surveillance, health promotion, food safety, vector-borne, technical guidelines, shelter surveillance, as well as we are providing a suite of different supplies, public health supplies. So that's our major role. And to further clarify, hurricane has passed, countries are now not in a state of emergency anymore. They are now in a recovery stage. So the work we are doing is supporting that in terms of providing public health supplies and other mechanisms and surveillance tools to help them recover better, to help them identify the infectious disease threats that may occur post-disaster so that they are able to recover. They'll be able to identify quickly and recover faster.
Thank you. Dion, remind us of the second question again.
So the second question is from Ms. Bridget Smith at the Division of Health, Tobago House of Assembly.
No.
She says, thank you for the great presentations, updates, and continued support to the region. What were the composition of the response teams on the ground, for example, the ICC Games, and where were they drawn from? Local ministries of health, regional agencies, etc. Thank you.
So the response teams on the ground were multi-sectoral and multi-agency. They comprise of ICC, Cricket West Indies, medical doctors from those different areas, the Carpha Health Response Team, as well as other agencies, and included the National Surveillance Team. So for example, at any game on any site, you would have surveillance teams from Ministry of Health, Cricket World Cup, Cricket West Indies, as well as Carpha. We also had a multifaceted team, not just in surveillance, but we had persons who were also in the lab and doing other functions.
Thank you. The third question, and then we'll go back to news team.
So from Linda Stryker, the May to August period is festival period for the Caribbean, especially the Eastern Caribbean. And this year we are dealing with Hurricane Beryl. What are the respiratory illnesses that traditionally emerge in this period? And are there new ones that this year that can be linked to climate change? Secondly, what are the re-emerging diseases in the region? What is the COVID-19 situation in the region in terms of variants?
Okay, so that's a very loaded question. Let me start and I would give the hard part to Dr. Cox. Yes, so yes, we're in the hurricane season and yes, we have a lot of emergent threats. So when you combine hurricanes with the impact of hurricane flooding and other types of factors that would lead to increased risk of infectious disease, can combine that with our mass gathering events, persons in close contact with each other. And it means there is that increased risk of, there's a likelihood of increased risk of infectious disease. What type of infectious disease we just presented? Persons, of course, respiratory illnesses like COVID and influenza and others are the more likely ones, because the closer you are, you have a more greater risk of transmitting, you know, an infectious disease like COVID. This is why we always say to, you know, cover your mouth to stay as far as possible, because while you're speaking and while you're talking or while you're hugging and kissing and partying, there is that risk if someone is sick. Then there are the other diseases, your diseases like we know what the region is endemic for arboviral diseases, which is, you know, our topic of contention at the moment, but it means then that we have to put measures in place for improving, reducing vector-borne diseases and improving any form, improving measures to reduce the risk of vector-borne disease. And you have other diseases like food safety, foodborne disease. Your normal thing that happens in a party, you know, salmonella and shigella, campylobacter, staphylococcus from persons not washing their hands and so on. So the combined package is what Carpha really is recommending is health promotion, food, environmental safety, vector-borne safety, reducing risk of infectious disease, supported by laboratory and surveillance so that we are reducing that risk. In addition, our novel mass gathering surveillance system for event-based allows us and allows countries to have digitalized electronic surveillance that, you know, at a moment you're able to enter data, it is instantly seen by all the persons who need to see it. If a threshold is passed, there is an alert that is sent to everyone instantly. You press a button, you get an instant report. What that allows is for rapid response. So in our big parties and our carnivals and so on, we can stop rapid spread with this instant type of surveillance.
Thank you very much. So we'll go back to Newsday and then we have one more question online and we'll wrap. Okay, I see that we'll allow you as you are in the room.
Right. I think it was mentioned by a speaker, thing about sexually transmitted diseases. About 20 years ago, the big issue was the big HIV, AIDS and HIV. Has the Caribbean won the fight against AIDS? Is it settled? Is it no longer a life-threatening disease in terms of its spread? Because we're talking about carnival season and so forth. Because we don't really get that hammering of the message that we would have been getting like 20, 25 years ago. So is it all well? And what are the numbers telling us? If that's open to the panel, please. Thank you.
Okay, thanks once more for the question. So regarding HIV/AIDS, yeah, you're right. So the point is that why isn't there that sizzling sensation in terms of information that's shared, right? And when I say information shared, why at the community level, why aren't persons talking about it, etc. And I believe that the reason for that may be because lots of progress would have been made in recent years, not just at the level of the Caribbean, but also at the global level. And from the perspective of HIV, there've been advancements with the medicines and how persons are treated, and also persons are followed up to see how those medicines address the issue of whether they're virally suppressed or not. And also to say that in alignment with the global targets, as you know, you have the global targets. You want 95% of the persons who are infected to be identified or detected. And then you want additionally for them to be on treatment and then suppressed, virally suppressed. So I think that there's been some level of reassurance regarding how it is approached, and there isn't this scare because there's also lots of information available to persons who are interested. And also in terms of treatment, treatment is fairly easy. You have care and treatment services that are available. Having said that, things have evolved to the extent where persons are even in some places encouraged now to do self-test from the perspective of the access health services, and they're counseled, and then also they can have access to tests and do the tests, and there's a mechanism to allow for that reporting. So I say all that to say that it's not an issue. Of course, there are many researchers that are looking at how to identify a cure for this disease, which we don't know of at this stage. That is available to persons, but notwithstanding that, as I've mentioned, in keeping with the global targets and addressing those, there've been many advancements in terms of treatment that's available, and also the care for the patients and how they should manage their interactions in society. So I think it's not to say, however, that there isn't need for us to strengthen the approach in terms of continuing to keep it on the agenda. As you've picked up, we have several things that compete on a daily basis from a public health perspective. And I think your point is well noted in that we need to reinforce that message from time to time. But notwithstanding that, I believe it really rests with the fact that there've been a lot of advancement in keeping with regional and global commitments, and as a result, there might not be this sizzling buzz where it's spoken about ever so often as before, but that still does not undermine the importance of it as a public health issue.
And to add to that, I want to not to reduce, the emphasis on HIV, but really to improve the emphasis on STIs on the whole. From a public health perspective, Carpha strongly recommends, to use condoms and to obviously to encourage safe sex as a method of prevention, because it's not just HIV, you have other STIs, and they are prevalent not just in our parties, but even during post hurricane, where persons are in shelters, they're in close contact, and lack of electricity and other things. So these other types of activities may become more engaging. So we encourage persons to practice safe measures when it comes to sexual practices.
Thank you very much. I will go to Dion online. Can you give us those questions? And then we will wrap with Ms. Cutting.
Thank you, Colin. Just to highlight that Linda Stryker said that I think one of the questions remains unanswered. What is the COVID-19 situation in the region in terms of variants?
Is that the only one
That's
that
the
we
only
have
one.
online?
That's the only one.
Okay, and Can we have a response from the panel? Then we'll go to Ms. Cutting and then we'll wrap.
So to start, and Dr. Cox will continue as well, the data that we are getting from COVID-19 is not focused only on COVID-19. Once the public health emergency of international concern was reduced, even though COVID-19 is still a pandemic, there was a shift in focus in terms of surveillance. So countries are not just surveying for COVID-19. So the numbers we see, may not necessarily reflect what is actually happening, but from the trend, we see that there is still new variants. We see that, it's still a risk. And of course, in virgin populations or populations that haven't been vaccinated, there's still an increase. There's a risk in vulnerable populations, persons with underlying illnesses and so on. So of course, populations now have more immunities compared to 3 years ago. So the numbers will be lower, but it doesn't mean it has stopped.
Dr. Cox?
Yes, and just to add to it that, as we mentioned earlier, the public health emergency it's no longer a public health emergency of international concern. As Dr. Indar mentioned, it's still a pandemic. The reality too is that because persons are better informed now, there's a lot of science after research was done to kind of reassure persons that with the right measures, life isn't endangered anymore. Of course, we have access to more medicines and pharmaceutical products. So the reality is that persons go about their daily lives in a very routine way. Notwithstanding, we'd like to take the opportunity to just let them know that, it's still an issue out there. We see persons getting infected. We see the reports coming in. And in pockets of the population, going back to the comment that was made, you can still find that you have cases, right? And we have been seeing that. So I use the opportunity to reassure the population that you really need not to forget all that you learned during that period of time. Of course, just stating that it's really a mixed bag in terms of what will contribute to it being a bigger issue. And based on what we're seeing now and based on the understanding of what's in circulation and the virulence, we can say that it's not necessarily one that is very virulent in terms of the variant that's in circulation. And so you can find persons, they get infected, but of course the rates of hospitalization and death are not as significant as we saw during the phases or the emergency phases of the pandemic, and when it was actually a public health emergency of international concern. But I think the message that we'd want to underscore is that it's still out there, and that's why you saw it featured in the presentation. It's still on the radar, and we continue to detect cases. So we don't want person to fall into a state of complacency and think that it's something that's totally behind us. And as we would have learned before, it's nothing strange to have new variants appear that can really be of major concern. And going back to the point that was made about the surveillance component, this is why it's been integrated, and this is why it's continued to be monitored. And this is why now with the capacity that's available, you have even at member state level, some member states that are sequencing for COVID-19. So this is to say a lot of work has been done, a lot of investment made. And so I know persons and systems are better empowered now to address the issue that is before us, but not by any means are we to say that it's all over, because just in the wink of an eye, things can change for many reasons, as we know before. But we certainly feel more empowered knowing that you have access to vaccines. For those who've not been vaccinated, just to encourage them to access the vaccines and be vaccinated. And of course, all the other things that people do routinely in terms of accessing health services, should they have any form of respiratory illnesses, we recommend that they continue to do those basic things and to access the services that are available. Thanks.
Thank you, Dr. Cox. Ms. Cutting?
Yes. Hello. Back to dengue. What is accounting for these suspected cases? Do we have any challenges with testing? If you could speak to Carpha's role in testing, and if you could perhaps tell us how many samples the agency has received and what percentage of those are actually confirmed to be dengue.
Yeah, those are good questions. I know the longer it goes, is the sharper your questions become, but I appreciate that. Having said that, Yeah, Carpha, as we mentioned, we are the regional reference lab and we do offer services to member states. Also, I'd like to take the opportunity to mention that member states have risen tremendously in terms of laboratory capacity. So in a lot of instances, member states can test, whether it's a molecular test within 5 days or whether it's a serological test after that to determine whether or not someone has dengue infection or has been exposed to it. Notwithstanding that surveillance is a package and we shared some components of it. Of course, the purpose was just to pinpoint and direct persons in a particular direction. But having said that, syndromic surveillance is one of the backbones of the effort that we do. And what does that say? It basically says based on XYZ presentation, whether signs and symptoms, where do we group this? And how does this help us to kind of focus our efforts and know if something is happening? We do that, but also we have the disease-specific ones. So after we would have confirmed, we know this is what it is. Notwithstanding all of that, before we can get to the point of saying that we have a dengue case, we do have case definitions that guide the engagement, right? Or that rationalization. So if I were to use a crude example of someone accessing health services at a health facility level, the person goes in, sees the clinician, says, I've had rash and fever, this is how the rash appeared, this has been my evolution, then right away it triggers something and the clinician says, well, I think it's dengue, right? Those things are required to be noted. Of course, at different levels of service delivery, you have different levels of preparedness. Depending on where you are in any given country, anywhere, they may have access to a suite of tests or they may not. But we do have mechanisms to capture whether it's a suspected case, whether it's a confirmed case, whether it's a probable case. And based on that, we know how to treat with it in terms of the action. So to kind of hone in on the specifics of the question that you asked, we've seen the increases in suspected cases because we've seen more persons appearing with the signs and symptoms that fall within that definition for dengue. And so that's required to be recorded and reported. Of course, we would also expect that persons would access services and be tested and be confirmed that they have dengue so that we know specifically. And that's why also we've seen that happening. So as I mentioned earlier, it goes hand in hand. And what we've been seeing in the data is what we would have rationalized and would have expected to see.
So does Carpha want to encourage member states to test every suspected dengue case to confirm?
I wouldn't say so. You have different levels of preparedness, and also it's a working solution, right? It takes understanding of the context. Every country is different. You need a multi-expert team to speak to what should be, what should not be, and to assess the perspective, not necessarily only on an individual basis, which benefits the patient, but also a broader basis, looking at the community nationally and what it would mean, because there are circumstances where we do not recommend testing every case. It's not, if you have an established outbreak, you know this is happening, and you have something that looks like dengue and talks like dengue, to put it crudely, then it's fair to assume that this is dengue. So based on the presentation, you can see, we know that something is happening here and we do have X, Y, Z. We need to also consider, for example, the resources that need to be invested into testing every single case. It's not cheap to do lab tests, but we do appreciate the importance of having a confirmed diagnosis as against just being dismissed and saying that it's suspected. So to conclude on that point, I think it's something that there's no black and white answer to it. There's gray area, and it takes for rationalization, taking into consideration different contexts from the epidemiological perspective and also other things, resource-wise, etc.
Thank you, Dr. Cox. But what is not black and white, or what is black and white, is that if we have symptoms of the disease, you are saying that we should visit our health center and let them assess whether there's need to go further.
Correct. And just to say quickly that often persons attempted to self-medicate, we do not recommend that. Often persons are tempted to use home remedies and they think they know what it is. But importantly, and this can also contribute to why you see increases in deaths, etc., is that you can miss danger signs. And the more you have transmission is the more the likelihood of progression to complicated forms of the disease. And if you miss danger signs, you'll be essentially endangering your own life. So as you correctly put it, I'd advise that we do not take the chance and make those assumptions, but that we actually access the services that are available and the health system is prepared to accommodate that sort of engagement.
Thank you so much. So thank you so much for your participation. We have come to the end of this morning's briefing. A sincere thank you to the members of the head table and also the members of the media, those in person here with us and also those online for supporting us by giving this event the importance that it deserves. Ladies and gentlemen, I must thank you all and I wish you a very good morning and rest of the day. Thank you. If you want to be in this, I think I'd like to question.